Okay, looks like we're ready to go. Can everybody hear me okay? All right. So my name is Sarah Cummins. I am owner of Waterfall Yoga, and I'm a yoga therapist and a pain care yoga instructor. And I basically empower individuals to master their health through the teachings of yoga. So there are going to be two topics that we kind of cover today in these alternative therapies for pain management. And that is, what is yoga therapy? How is yoga therapy different from a yoga class, or a yoga therapist different from a yoga teacher? And then we'll also talk a little bit later about pain science, the understanding of what happens to our brains when we live with persistent or chronic pain. And why that's important, basically, is to help us to understand that change, the chemical change that happens in our body and what happens to our nervous system when we live with long-term pain. And sometimes understanding that helps us to overcome or helps us to reduce the amount of pain that we feel in the body. So nearly 1 in 5 Americans say that pain interferes with their daily life. And likely if you're here today, you or someone you love lives with this feeling of persistent pain. And so it's important to understand some of the options that we have, because each of us has very unique pain. No two of us are going to feel pain the same way. And it's also important to understand that pain isn't always what we think it is. So we'll talk about some of these things today. We'll have a little break in the middle, and we'll have time for questions as well. All right, so we'll start with, what is yoga therapy? So most of us, when we think of yoga in the Western sense of the word, we think of something that maybe only a particular group of people are capable of doing. And yoga therapy is kind of a new modality where we are actually making sure yoga is available to everybody, no matter what. We know, based on all the studies that we've seen, that yoga is therapeutic, that there are many benefits to doing yoga. But yoga therapy takes specific tools and applies them to individuals' specific needs. So we may use breath work or movement, posture assessments. We might do meditations, mantras, affirmations. We also use what's called Ayurvedic techniques a lot of the time. And Ayurveda is the science of life. It's an Eastern medicine. We take pieces of that and incorporate all of them together so that you can feel better in your body. And we address the person's individual needs based on this idea of a holistic perspective. So you are not just your physical body. There are a lot of other things going on within you. So we're going to look at the mental, the emotional body, the energetic body, as well as your spiritual and intellectual bodies as well. So we're looking for that holistic perspective to find the root of your pain or your problem. So obviously we're here today to talk about pain or chronic pain. So we know that yoga helps us with low back pain, with arthritis, with fibromyalgia, lupus, inflammatory diseases. We also know, if you live in chronic pain, that a lot of the times our mental health is affected by that pain. So we may end up with anxiety or depression because of that physical issue. In addition, our mental health sometimes can cause physical pain as well. So trauma, post-traumatic stress, insomnia, or even grief and loss. Grief and loss is huge in the cause of chronic pain. So those two, mental and physical, go hand in hand. Then we also have neurological issues. So this goes back to the idea that yoga is for everybody. We can help people with stroke, MS, Parkinson's, and traumatic brain injury. More commonly now, there are yoga therapists working in cancer centers. So helping to recover from cancer, helping them through the chemotherapy and radiation process. We also help people with diabetes, heart disease, and then oftentimes you can find us in addiction recovery centers. And of course, we help people with healthy aging, osteoporosis, osteopenia, flexibility, and balance and fall prevention. So then, what's the difference between a yoga instructor and a yoga therapist? And a yoga teacher is going to have gone to 200 hours of training. They're going to get training in the foundations of yoga, the philosophies of yoga, basic anatomy and physiology, and they're also going to practice teaching with a teacher. A yoga therapist goes to school for another 800 hours, so 1,000 total hours minimum. It takes them about 2 to 5 years to complete the program, and it's under an accredited training program called the International Association of Yoga Therapists. And that program has been around. It's a nonprofit program that's been around since 1989. Those yoga therapists then will continue their training, and they will get more psychology and biomedicine training, in-depth anatomy and pathophysiology. They're going to learn ways to adapt to specific people's needs. So most of us, just like a physician would, will find their niche, what they really enjoy, and the type of people they enjoy working with. So in my case, chronic pain is my main focus. And then they also do extensive clinical practicum. So again, just like your physician has to practice on real people before they're considered being a doctor, same thing happens here. We practice on people, and we get that training hands-on. So what's the difference between a yoga class and a yoga therapy session? Well, most of us have an idea of what yoga is. We know that we go into a classroom setting. There's a teacher. We're usually with a group of other people, like-minded in our thought processes. And we're going to get instruction by a teacher on specific yoga technique. It's a general practice. Usually there's some sort of focus or theme. And in the Western world, it's very often fitness-oriented, which is why we have this idea that only a certain type of people can do yoga. And it's generally limited in its individual adaptations, because that teacher may have 6 to 20 students in the classroom. She's probably not going to know you on a really personal level, at least not all of you. And so for her to be able to know what's going on individually with each and every one of you and make those adaptations, it could be very challenging or difficult. So with yoga therapy, we usually do one-on-one sessions. However, we do small groups. Usually, like I mentioned, the cancer centers have group cancer yoga therapy sessions or addiction therapy sessions. And then I will be offering a pain care session over at the Pyramid, which I'll mention later, starting January 31st. And so we work together as a group with a similar issue, and we go through the process together. Most of the time, yoga therapy is done one-on-one. So it's an individual assessment, and then there's an intake form. So you'll fill out an extensive intake form about that holistic person that you are. We'll ask you questions about how much time you spend sleeping, what you eat, how much water do you drink, how much time do you spend sitting, as well as many other questions. How do you find joy? What kind of emotional traumas might you have been through in your lifetime? When did the pain start? And on and on. So we have this really in-depth idea of who you are and what's going on. Then we're going to address in the assessment your posture and your range of motion and movement, and look at specific concerns that you might have or specific concerns that come up that I see in the evaluation. We're going to tailor the class to your specific goals. What do you want to accomplish while you're working with me? And then I'm hoping to empower you to take those tools or techniques that I give you to go out and practice in your daily life, so that we can start to see some change, see what works and what doesn't work. Now, as I mentioned, each one of us' pain is very unique and individual. So what I give to one person for low back pain, I may not give to the other person with low back pain, because they're very, very specific on why that pain is there. So we'll work together to figure that over a course of time. And it's going to be a therapeutic relationship, which means just like when you go to your physician, you tell them all of your life story, that physician knows that you are both speaking in confidence. Same thing happens when you speak to your yoga therapist. And the best part is you don't have to know yoga to see a yoga therapist. So how does yoga therapy work? Well, ideally, we've discovered that this holistic person that you are, all of these pieces of you, are very interconnected. So we found through studies that if we take one tool, such as breath work, and we work on you breathing more fully, more completely into your body, that it affects your musculoskeletal system, but also your neurological system and your nervous system. So does anybody have any questions about that? About yoga therapy? We're clear? All right. So before we move on to the second portion of my discussion, I would like to do a little movement. I am a yoga teacher, so we do make people move. And this will help you to listen to the next part, which is more scientific in nature. So I want you to be awake and alert. So if you could scooch your chairs back just a little bit, give yourself a little bit of space at least. Just enough room that you can move your legs a little and your arms a little bit. Okay, so in yoga therapy, in the pain care series that I'll be offering here at Reardon Clinic, we do often what's called a joint freeing series. And that's basically to begin to move life force or energy throughout your body. We spend a lot of time sitting and not moving, and so it causes a lot of stagnation in the energy of our body. We start to feel fatigue and lethargy. So this is one I commonly do. I normally would take a lot more time to do it, but since we're kind of in a time constraint here, we'll speed up the process a little bit. Now, I don't know all of you individually, and I haven't done an intake form on you, so I don't know what your pain is like today or what you're feeling or what injuries you're working with. So be mindful and know that you can visualize the movement. You could just close your eyes and picture yourself doing that if there is pain in your body. And I'll talk more about visualization later and why that's important. So let's start by kind of uncrossing your legs if your legs are crossed, and let your feet rest on the floor, on the earth, and bring your ankles underneath your knees. And we always try to sit up with a nice posture, shoulders back, lengthen your spine. And then if you feel safe or comfortable, close your eyes. If you don't, just kind of look down at the table in front of you so that you can turn your attention inward to how you're feeling. And then I want you to notice your natural breath. Just for a second, pause and observe your breath. And then see if you can start to make your breath a little bit longer. See if you can make your breath a little bit smoother. One breath flowing into the next. Each breath unique and individual. And see if you can make your breath not just longer and smoother, but softer, trying not to force it or change it. Good. Now as we start to move the parts of the body, we're going to do just that, joint freeing series. So moving from one joint to the next, lubricating and bringing synovial fluid into those joints. So you can keep your eyes closed or you can open them, and we're going to start at the feet. So I want you to just take right ankle, kind of set it out in front of you and roll a few nice slow circles. And I know we're all wearing our shoes and socks, but try to move it really slowly and mindfully and see if you hear some maybe popping or clicking in the joints. If it feels a little sticky, and then go the other way. Good, and remember to breathe. Relax your foot down. Let's switch to the other side. So extending that leg out, roll a few clockwise circles. We have the tendency to speed it up, so really slow it down here. Feel if there's some stagnation in the movement. And then move the other direction, counterclockwise. Good, and then let that leg rest and observe your ankles. Maybe you feel the flow of energy there already, the flow of movement, of blood flow, and oxygen to that space. Okay, so let's go back to the first leg, the right leg, and we're going to start to move the knee joint. So you're going to bring the knee into bent position and then straightened position. It doesn't have to be a real hard, exaggerated movement, but notice if you hear or feel some popping in the knee joint. Inhale as you extend and exhale as you bend. And you might notice on this leg, maybe you can lift it higher than your other leg, or you might feel the hamstring really tight or the calf muscle really tight. Go ahead and set that one down, relax. And then when you're ready, switch to the other side. Inhaling and exhaling to bend. And this cold weather really brings out some of that popping and clicking in our joints. So you might hear it more so on cold days than you do on warm days. Good. So let that leg relax. Observe the knee joints. Feel what it feels like. Do you feel that energy kind of flowing upward from the ground? Now we're going to move up to the hips. So most of us are in a chair with the back against the seat. So maybe you wiggle your butt forward a little bit so you have a little more flexibility or ability to move. And then maybe even take your hands onto your hips so that you can feel that hip joint. And we're going to start to move the spine in flexion and extension. So as you breathe in, think about tilting the pelvis back, lifting your chest, and opening your heart. And then as you exhale, tuck your tailbone under, let your shoulder blades round towards the back of the chair, tuck the chin to your chest. So inhaling, letting the chest open, and exhale, rounding the back. And again, if there's a lot of pain today somewhere in your back, maybe you just visualize the movement. Picture yourself doing it and your body moving freely and openly. Where do you feel the tension when you do this? Is there a specific area where it feels really tight and locked? Good. Now return back to neutral spine. So we've kind of moved your spine this way. Now we want to take some side bends. So we want to move side to side, that lateral movement. So just to let your arms hang or hold on to the side of your chair, and then lean one direction. Inhale up, and exhale, lean the other direction. And again, it doesn't have to be your deepest stretch. It can be very mild. Maybe you close your eyes and tune into the sensations. What are you feeling? Is there some popping in the spinal column? Is there maybe some tightness over the top of your hip or in your low back? One more time to this side. One more time to the other side. And then come back to neutral spine. Stack the vertebrae. Relax your arms. Okay. Next one, spinal twist. And I think a lot of people in their mind think we need to like really get a good pop or something and really jerk our body into a twist. I want you to think about it very, very gently, where it's almost like you're turning to look at something behind you, and only this upper part of your body turns. So let your arms relax in your lap or either hold on to the side of the chair so you feel stable. And then I want you to turn as if someone just said something to you over your right shoulder. And then exhale back to center. Very slowly turn to look over the left shoulder. And do that 2 more times to both sides. Being gentle on the body, just observing. Where do you feel some stuckness? Or does your body want to move really smoothly today? Moving with your breath. Our breath is very important in the process. So next time you come back to center, relax, maybe close down your eyes again, and turn your attention inward. How does your spine feel? How does the torso feel? Can you feel that energy now from the ground up to your spine? Okay. So next, let's take our hands out from underneath the table and bring them on top. And I want you to stretch and open your fingers really wide. And then close your fingers into a fist. And do that a couple times. See if you feel some tightness or tension in your joints. Maybe you have arthritis, carpal tunnel, things that you're going to feel here as you move your hands. All right, now take your hands into a gentle fist. Sort of straighten your elbows out in front of you, but keep them kind of relaxed. And then I want you to look at your wrist joints and focus and see if you can move just your wrist, not your arm, not your elbow. Isolate the movement into wrist circles. And see if one moves more smoothly, more openly than the other. And after you've gone a few times one direction, go the other direction. Remembering in-breath and out-breath. Good. And then let the wrists relax. Rotate your palms to face up. Open your fingers. You're going to notice any sensations you feel in the center of your palms, the hands, the fingertips. Okay, now with palms facing up, draw your fingertips towards each other, towards the center of your body, and then roll them away. So kind of lateral movement in the wrist joint. Not something that we think about doing very often. So your elbows and your shoulders kind of stay neutral, and you're trying to isolate it into your wrists as much as possible. Good. And then let that relax. We're going to stretch the arms back out in front of us and move up to the elbow joint. So you're going to let your fingers be soft, bend your elbows, and bring your fingertips to touch your shoulders if possible. And then inhale, open them up. Exhale, close them back. And here what you're looking for is, do my elbows pop? Do I hear some crunchy sounds in the elbow joints? Do I hyperextend and really lock my elbows out, or do I keep a nice soft bend? Is one arm more mobile than the other? Maybe you've experienced an injury or had golfer's elbow or tennis elbow. And then this time, let the fingertips stay on your shoulder blades and see if you can bring your elbows towards each other and then apart. Elbows towards and then apart. So let's exhale as we squeeze together. Inhale, take a deep breath as you open back. Notice anything you feel here as you move those shoulders, open and close. The next time that your elbows come towards each other, let's draw some circles with the tips of your elbows. So whatever your range of motion is here, try not to hit your neighbor. See if you feel maybe some grinding sounds in the shoulders. Or maybe you've had an injury in one and there's less range of motion. Just observe what's going on in your physical body and what you're feeling. With your breath, start to relax the elbows down, let your arms relax in your lap. Take a moment to notice. Breathe in and out. What do you feel now in this upper body? Okay. So now we've worked through elbows, wrists, shoulders. Let's look at the neck. A lot of people carry chronic pain and tension in the neck. So I want you to think about your range of motion here. Maybe you have to visualize it if you have some cervical injuries. But as you breathe in, I want you to let your chin tilt slightly up towards the ceiling, staying in control of the neck, not letting it just drop back. And then as you exhale, draw your chin down towards your chest. Without trying to force yourself to be somewhere you're not today, inhale, lift the head. Exhale, lower. And see what's happening in the cervical spine. What do you feel? Go slow enough that you feel the muscles that allow you to be able to move your head this way. Next time your head comes back to neutral position, let's turn and look over the right shoulder. And then back to center as you exhale. Inhale, turn to look over your left shoulder. Managing your pain by stopping before you start to feel your body scream at you. Keeping the breath longer, smoother, and softer. Not trying to rush the movement. And the next time your head comes back to center, we'll tilt the head so that the ear drops towards the shoulder. And then inhale back to center, exhale to the other side. So this little tick-tock motion of the head, nice and slow. Notice if one shoulder wants to rise up to compensate for that movement. Try to keep your shoulders immobile, just the movement in the neck. Next time you exhale your head back to center, maybe close down your eyes, observe your breath and how it feels in your neck. Lovely. Now let's move up into the face a little bit. So we always tend to hold a lot of tension in the jaw. When we feel tension in other parts of the body, the jaw tends to clench and grip and hold a lot of tightness. So just for a moment, maybe even take your hands onto your jaw and open and close. You don't have to open very wide. Just kind of feel the movement in your jaw. Maybe even move your jaw side to side, right to left. See if you feel under your fingers, again, popping, clicking. Maybe you feel more of an S movement as you open and close your jaw versus an up and down movement. Maybe you can hear it in your ears. Good, and then relax your jaw. Let the teeth slightly separate, the tongue be heavy in the mouth. Notice any sensation of taste or dryness or moisture in your mouth. Let your arms relax. Good. Now go inward again. Feel that longer, smoother, softer breath. One more time. Notice if the breath pattern has changed. If you feel a little more calm, a little more relaxed. And then start to blink your eyes open. Blinking a few times, feeling maybe some tension in your eyes, the temples, the forehead. Maybe even take the eyes and look around the room in a circular motion. Look right to left and up and down. So exercising those eyes a little. We don't think to do that very often either. Good, and then come back to the front of the room. So how does everybody feel? You feel a little more awake? Are you ready to listen to some science? All right, so we know that there are many misconceptions of pain and that they can be barriers as far as reducing our pain. And so this part is going to educate you a little bit on some things that you can do, hopefully in addition to the joint freeing series at home, to reduce your pain. So the trick, or the key is that the medicine cabinet is inside of you. We're human, so all of us at some point in our life are going to experience suffering or pain, whether it be emotional or physical or both. And unfortunately, there's no quick fix. There's no magic pill that's going to fix us. And each of our pain is very unique based on our experiences. So when our pain is unique, there's not usually just one thing that's going to fix all your pain. You're going to have to find some different modalities or things that can work together to reduce or eliminate your pain. So one of the things that yoga does is help us to come to some different perspectives or find different viewpoints of our pain. And that's what we're going to be talking about today. So this girl here has a paper cut. We've all had a paper cut at some point in our life. And we know that a paper cut hurts pretty darn bad. But the amount of damage done to the tissue is really not that bad at all. We're going to heal pretty quickly. So this tells us already that our pain is complex. It's very complicated in that it's not an accurate indicator of how much tissue damage is happening to the body. So then, what is the purpose of pain? Why do we feel it? Well, pain is a sophisticated protection mechanism designed to protect us. But we think that pain is to tell us where it is and what it is and how bad it is. But that's simply not the case. If we think about that paper cut or even a brain freeze, we know that it hurts very badly, but there's not any significant tissue damage to the body. So the true purpose of pain is to tell us that there's evidence of possible danger and that we need to stop or change our behavior. So the International Association for the Study of Pain defines pain. But first we want to talk about what are some of the protection ways that we can, that we feel in our body, the indicators that something's going on. Well, first we might feel an unpleasant sensation. So we might have tingling, numbness, shooting pain. We might experience tight muscles. Most of us that have lived in chronic pain feel that we hold a lot of tension in our bodies. You might experience muscle weakness. So in an example of stubbing your toe or hitting your knee on the coffee table, the first thing you do is pick your leg up and hold it. Well, that's an automatic protection response to keep you from injuring yourself even further. Protective postures. If something's being thrown at you or someone's going to hit you, the first thing you do is cover your head and your internal organs. That's an automatic protection response. Fear, anger, and anxiety. So the feelings that we have with fight, flight, or freeze in our sympathetic nervous system. Those are reactions to protect us. And then also changing our breathing. So we might hold our breath or we might breathe very, very quickly. So here's the definition. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So I have a story that kind of goes along with this that might help describe it a little better. Lorimer Moseley, he's a neuroscientist that lives in Australia. And he's huge in the study of pain and pain science. He tells a story about walking in the Australian bush one day, and he starts to feel a sensation on the outside of his leg, on the skin. So what happens is that touch to the skin sends nociceptors or signals up the leg to the spinal cord, and the spinal cord's nerves send a message to the brain, and the brain has to evaluate, is that touch on the skin dangerous? So within moments, without even our thinking brain activating, we think the brain gets the signal that something has touched the skin. So when it's touched the skin, then the brain has to evaluate. And it says, is this dangerous? Have we been here before? And in Lorimer's case, he grew up in Australia, so he'd been through the bush a million times. And he gets the message, yes, we've been here before. Has it happened in this stage of the gait cycle? Yes, it has. So is this dangerous? And his brain says, no, it's not dangerous. We've done this all of our lives, and it's usually just a twig. Well, 3 days later, Lorimer wakes up in the hospital. He had been bitten by an eastern brown snake, a very poisonous snake in Australia. So now he's almost died. His experience has changed. 6 months later, he goes out to walk in the bush again. And as most of you know, Australia is full of poisonous things that will try to kill us. So Lorimer, being an Australian, is used to it. He just goes back to his normal life. So he's walking, and again, something touches the outside of the leg on the skin. This time, Lorimer's reaction is different because of his experience. Now he feels excruciating pain, and he drops to the ground, screaming in agony. Within seconds, again, without his conscious brain thinking, the nerves sent messages from the spot that was touched on his leg to the spinal cord and to the brain. And the brain now has information it has to process. Is this dangerous? This time the brain says yes, because last time you almost died. And so this time it sends pain signal. It says, this is painful. You need to do something about it. This is dangerous. Stop or change your behavior. So this time he feels pain based on that unpleasant sensory or emotional experience. So do you think pain then attaches to experience? It absolutely does, because anything that we've experienced in the past affects our pain now, and any of our predicted future experiences will affect our pain now. So again, reminding us that pain is complex. Now, the second part of the definition is that it's associated with actual or potential tissue damage. And if you all take your finger and pull back on it, you're going to start to feel the sensation of pain. But if you let go of it, that sensation immediately goes away. So this is your brain telling you that if you keep doing this, it could cause actual tissue damage. So it's telling you through those pain sensations to stop or change your behavior. The last part of the definition, or described in terms of such damage, is important because if we think about the words that we use to describe our pain, stabbing, cutting, electric, burning, shooting, they're all very strong words in our language. The same thing goes for if your doctor tells you that you have a slipped disc. What happens with that language is that we think that our disc has literally slipped from the spinal column and is floating somewhere in our body. But in reality, that doesn't actually happen. So slipped disc is not a very good way to describe someone's injury or issue, because language is really important and it changes, messes with our brains. So we now know pain is an alarm system. It's there to warn us when we've been damaged, and it's there to warn us when we're approaching damage. We also now know that pain is a protective system. It can warn us when we're in a situation similar to a time in the past that we've experienced pain. So one of the brain's many jobs is to make a sensible story from all the information that it's receiving. And it does this by relying on our nervous system. So we've already talked about our nervous system. It has 3 parts: the nerves, the spinal cord, and the brain. And those parts work together to let us know what is happening both inside and outside the body and help us to decide how we're going to act or react. And as in Lorimer's case, we saw the first time, even though it was very dangerous, he felt no pain because he hadn't had the experience of something being dangerous. The second time, he felt excruciating pain because he'd almost died before. That experience changed his perception of the pain. But in reality, it was simply a twig the second time. So he shouldn't have been feeling excruciating pain, but he was. So now we know that our nervous system is adaptable. It can change. It's constantly changing based on information. It's never static, and it's able to learn new ways to function. So the brain is constantly receiving messages about everything that's happening in the body. And it's deciding whether or not to turn up the intensity or to turn down the intensity. And just kind of keep thinking about Lorimer's example there, how his intensity turned down when there was actual danger and how it turned up when there wasn't. So what's happening is the resting level of the neurons are changing all the time based on your experiences and events in your life. And these reactions are protective mechanisms that are meant to help in the short term. But if we have chronic or persistent pain where we're constantly living in pain, then this vicious cycle starts to occur. We start to have more thoughts of fear, more rumination, which means that we're thinking about the pain all the time. It's the number one thing on our mind when we wake up, and it's the number one thing on our mind when we go to sleep. In addition, we could also start catastrophizing. We could start really thinking, this pain is never going to go away. I'm never going to feel like I used to. Or maybe I'm dying. Maybe something's very wrong with me. And so this leads to feelings of anxiety and anger and depression. And these reactions feed back into that pain system, always helping to increase or spread our pain, making our pain worse than it actually is. So this happens when chemicals start to change in our brain. And those chemicals change that it's producing and releasing, and they are hormones and also our immune levels. And they're affecting that fight, flight, or freeze reaction. So the sympathetic nervous system being fight, flight, or freeze, we have a hard time coming out of that and coming back into a state of relaxation. And all of the input systems are affecting that. So we have sensations, we have our thoughts and emotions, and we have our experiences and our memories. So I'd like you to take a look at this box here and see if you can bring one back edge of the box forward and then back again with your vision. So our pain is affected by our perceptions. And this visual illusion is important information about how our nervous system is working. So I want you to continue to look at that image and see if maybe if you look away and look back at it again, if you can change how it looks to you. What's happening is that we're exciting neurons in our eyes, which are sending information to your brain, and your brain is deciding in an instant how to see that cube without your conscious thinking brain. So this is an automatic thing that's happening within the nervous system. Now, if I change and I add a little red dot, I change the context up a little bit. See if you can bring the red dot to the front corner of the cube and then back again. Your brain is deciding to see the cube one way, and you're consciously deciding to see it another. So our perceptions are influenced by our context. So then it makes us wonder, do we actually hurt as bad as we think we do, or is it merely an illusion? So we know now our brain's doing all kinds of cool stuff outside of our awareness without our thinking brain. And unlike a visual illusion, pain is about survival. So if pain is an output of the brain designed to protect you, and you can change how your brain decides to see the cube, can you change how your brain decides to perceive those danger signals? And the answer is yes. You have the power to change your nervous system. Therefore, you can influence your pain. All right, so what we know about the nervous system is that it provides us with experiences and not with facts. The experiences we have and the sensations we feel are affected by everything around us, and so is our pain. Pain is very unique, and now we know that what we perceive through our senses is not accurate information. We also know that pain is not an accurate indicator of what is happening in your body. Even though we expect our pain to tell us where the pain is, what it is, and how bad it is, it simply doesn't do that. So that by coming to a new understanding of your pain, you're better able to move your body and live well again. Now, we'll go back to the study of persistent pain and those changes that are happening in the body. We're experiencing changes in our neurons within our tissue. We're experiencing neurons changing in the spinal cord, and also the neurons and the chemistry of the brain is changing. So think about how if we think about the same ruminating thoughts all the time, if we're thinking about our fear surrounding the pain and all the things that we can't do anymore like we used to be able to do, we start to create these nociceptive pathways, these frequent roads of travel in the brain. And so it becomes easier and easier to keep thinking those negative, repetitive thoughts. And then the illusion happens that our pain is more sensitive, that our pain is spreading, that the body loses its ability to be precise and to actually tell you what is going on. So our pain, now that this has changed, has become very uninformative and unhelpful. But remember that we have the ability to change our pain. So how do we do that? How do we get that alarm system to change? This is a graph of a person who has normal pain. So they've never experienced this chronic pain issue. Their alarm is going to tell them that there's an indicator that they need to stop or change their behavior at the point of tissue damage. So they have a lot of tolerance before they start to feel that alarm system go off. Now, this is a person who's experienced chronic pain. They've been in persistent pain for longer than 3 months. Now you can see their tissue tolerance is a lot less. They're going to damage their bodies a little bit sooner. But their alarm system is going off way down here, way before it ever gets to actual bodily damage. So now we're feeling the pain clear down here after we've hardly done any activity at all. How do we get it to go back to that normal intensity? And if we look at this next graph, getting it to go back up to that point, we have to think about where that is in the body. How can we test that alarm system? How can we challenge it so we can get it to move from down here back up to where it used to be? So we do this with that little sheet of paper you might have in front of you or that you can pick up afterwards. We do it with what's called pain care guidelines. Now, my teacher, Neil Pearson, is from Canada. He's a physical therapist and a yoga therapist. And he trains medical professionals as well as yoga teachers and physical therapists about these ideas with pain science. And he came up with this chart to be able to teach people how to reduce their pain and get that alarm system to go back up to where it should be. Now, we all know if we lived in chronic pain that pain is a moving target. Every day, your pain may be different. That's why this chart is so important. You may have a really bad pain day, and we might have to go to that point where we just visualize movement. Maybe there's a day that you can't get out of bed and do the things that you want to do. But if you can visualize yourself doing the challenging activity, doing the movement, you start to change those nociceptive pathways in your brain, therefore changing your nervous system and changing your pain. So what we do is we start with a challenging activity. Now, for all of us, that's going to be different. Probably every day is going to be different. Maybe it's walking around the block. Maybe it's planting a flower in your garden. Maybe it's simply being able to reach the top shelf and pull down a cup. So whatever that challenging activity is, figure what that is for you that day. And we want to move that alarm system up. So we challenge the alarm by finding where the edge is, the sweet spot. We want to find where we feel just the initiation, that initial sensation of pain, but our body's not screaming at us. And we do that by asking, is it safe for my body? Is it safe to do this activity? Am I actually going to damage any tissues walking around the block? No, I'm fine. Will it be okay later? If I walk around the block, am I going to be able to get out of bed tomorrow? Am I going to be able to get down on the floor and play with my grandkids? Then you ask yourself a few more questions. Can I stay at this edge where I feel just the onset, that initial set of pain, while keeping my breath calm? So being able to breathe freely, not holding your breath, not breathing super quickly. Can I keep my muscle tension low? So if we chose walking around the block, and I'm walking, but then I start to slouch and I start to feel my shoulders right up towards my neck, then I'm probably not monitoring my pain very well. I need to take time to calm my nervous system back down and calm the pain back down. And we want to learn to teach our bodies this so that we do it quickly, so our body can quickly come out of that fight, flight, freeze response into the relaxation response. So move to the edge of increased pain with a challenging activity. Is it safe for my body? Will I be okay later? And can I keep my breath calm and my body tension low while I continue to monitor my pain? So 3 important things with pain self-care in changing that alarm system, and that is to find different techniques or different goals for you. And every day they may be different. Challenging your body in some way, doing something that brings you to that point where you feel the sensation of pain, but your body's not screaming at you to stop. And then when it starts getting to where you can't breathe freely, you're feeling muscular tension, then you calm your nervous system down. And we might do that with the breath practice we practiced at the beginning. Longer, smoother, softer breath. Closing our eyes. Maybe taking in a little imagery or meditation or visualizing the movement and our body doing what we want it to do. Calming the nervous system down, taking as many breaks as we need to get that alarm system to go back up. Now the challenging part is that we all have an ego. We all know our body used to be capable of doing a lot of things. And so we want to push. We're a Western culture of pushing. Keep pushing through the pain. Ignore the pain. Instead, what we need to do is honor the pain. Not think about it too much, but also not think about it too little. Be able to recognize that the pain is changing and that sometimes we need to take moments to rest and relax. All right, so almost done here. Yoga can help us with pain. And of course, I'm a yoga instructor, yoga therapist. I have to talk about yoga and some of its benefits. And that is that it initiates feelings of gratitude and positivity. So most of us, if we've lived in chronic pain, know it's kind of hard to be grateful some days. And it's kind of hard to be positive. So this yoga practice helps us to change that aspect. Again, changing the nociceptive pathways, those frequent thoughts that travel the brain. And then it helps us to remain aware of the moment. We also know that we tend to ruminate on the pain, and that's all we think about. So it helps us to be present in our body, notice the sensations, but not noticing them so much that we start to have those feelings of concern and worry. It helps to increase dopamine and release tension in the body. The breath stimulates the vagus nerve, which awakens the parasympathetic nervous system. It helps to bring forth a feeling of being connected and safe. Creates a sense of balance, harmony, and groundedness. And it also helps us to deal with the emotions. So does anybody have any questions about the pain science portion? Yes.
Okay, so our person in Australia been hundreds of times through the brush. He gets hurt. The next time it's painful. Goes to the ground. What happens the next time?
The third time? Yeah, so good question. He's asking if Lorimer did not feel the pain the first time, but he was actually injured. And then the second time, when he felt something on the outside of his leg on the skin, he collapsed in pain. What happens the third time? So it's a good question because now he's had that experience of almost dying from a snake bite. Now when he feels something touch the outside of his leg on the skin, what's going to happen? Well, in most of us, that experience or that life event that happened to us will always be with us. We're not going to forget it unless we got amnesia or something. So in the case of when it happens again, and he continues to do this, he may continue to experience excruciating pain, or at least, the fear, the fight, flight, freeze response. So if you think back to a similar sensation or something that has happened to you or a situation, maybe maybe in your 20s you had a lot of tequila and you got really, really sick. Now, as an adult, years later, if somebody mentions tequila or asks if you want a margarita or you even smell tequila, it'll make you have the response of feeling sick. Like, no, I'm good. I don't want to have any of that. Your body remembers that experience. So it's likely that that will never go away for him. That if something touches the outside of his leg on the skin, his first response is, I could die. So Lorimer has to learn, and because he's a neuroscientist, he understands why that happened to him. But most of us don't. We don't understand why that you're feeling pain when there should be no pain. And so the understanding helps us that when that situation happens again, we can calm the nervous system down and check it out. Notice, okay, I'm safe. This is okay. I can do this movement and everything is fine. That it's just your nervous system's response to protect you.
I have one more question.
Yes.
So if I have my chronic pain and I learn to deal with chronic pain using steps, what happens if I get a brain tumor that's causing me great pain?
Mm-hmm.
And I go through these steps to learn to deal with my pain.
Mm-hmm.
And the pain is telling me I have a brain tumor.
Yeah.
So when do I acknowledge pain, that it's telling me I have a serious injury,
Mm-hmm.
and when do I manage pain to say I can handle it?
Yeah, so he's asking if I feel pain now and I learn to monitor it, but then some physical thing happens, such as a brain tumor that's causing pain again, how do I use these tools to recognize the difference, right, between having an actual physical problem and then having, just the pain? That's what you're saying, kind of?
Well, right, so I have arthritis or a cold disc,
Mm-hmm.
that if I continue with my arthritis pain,
Mm-hmm.
it's not going to damage my body.
Yes, that doing a challenging activity is not
Okay,
going...
I'm going to hurt tomorrow.
Yes.
But it's not going to be life-threatening.
Right.
So I get a brain tumor,
Mm-hmm.
learn to manage my brain tumor
Mm-hmm.
pain, and all the while it's growing, and it actually is damaging my body.
Yes.
So how do I say, this pain is okay for me to manage, this pain is actually telling me
Yes.
I have a life-threatening condition?
Yeah, so a really good question, because many of us who are feeling pain have also something that caused it, right? There was an injury to the body, or we have a tumor, or we have a slip disc or a bulging disc. So he's asking, how do you monitor that if there is a reason for actual damage to the body? So there's a careful balance, just like we talked about, where you have to be able to gauge that. Notice what you're capable of today may be different than what you were capable of yesterday. I think that, yes, there are things that could be causing you physical pain. So, for example, if we think about a bulging disc, maybe you're not going to do a forward bend in a yoga class. That's not going to be something that I would recommend for you to do. So, in that case, that may be a challenging activity that is beyond what you need to be doing right now. So then you find a challenging activity that's still challenging, but not going to damage that bulging disc in the body. So yes, you may be feeling pain from the bulging disc, but there are things that you can move and do that challenge the pain, that change that alarm system over time. And again, every day will be different, and every activity would be different for each individual, depending on all the things going on. Does that kind of make sense? Yeah, it is a complicated subject to understand, especially in a 1-hour workshop. Yeah, but taking it one day at a time and taking it one challenging activity at a time. And it would be easier to know, like in a private setting where I know all of the things going on with you and what's happening, to help you find that challenging activity that's not going to damage the actual tissues in your body. Anybody else? All right, so I just want to remind everyone that I am teaching an Overcome Pain Gentle Yoga series. It's 5 weeks starting January 31st from 12 to 1 out here in the Pyramid. And you can sign up after class with me if you'd like. There's also more resources and information on my teacher's website, paincareu.com. And then you can also visit my website, waterfallyogallc.com, and see me about private sessions. Some of the brochures and the paperwork back there will have information on public classes I do, as well as information on how the private session works. And then if you'd like to know more information, please sign up on the email list back there. All right. Thanks for coming today. Thanks for listening in. And if you have any questions, I'll be around for a little bit. How do you dress for that? Good question. Okay, he asked, how do you dress for the yoga class? So if you're coming, it's likely going to be in a chair. You'll want to wear some comfy clothing. You'll want to wear something that you can move around a little bit freely in, so maybe some sweatpants, maybe leave the belt off, something that gives you some freedom to move the joints like we did today. Most likely be in a chair. Depends on who shows up and what everybody's capable of, but in most cases, we're in a chair, not making people get down, up, and off the floor. Yes, you'll have an intake form that's a little less extensive than if I work with you privately, but you will have a little intake form you fill out so that I know exactly what's going on with you.